Hi, I am Dr. Suman M.B, lead orthopedic oncosurgeon at Mazumdar Shaw Medical Center, Narayana Health City, Bangalore. So July is an important month to us because it's a Sarcoma Awareness Month. So I am here to share few information regarding bone cancers. Bone cancers are quite rare, but they usually occur in age group between 10 to 40 years. The most common bone cancer what we see in our practice are osteosarcoma, Ewing's sarcoma and chondrosarcomas. There are no exact reason why we get bone cancer, but yes, they don't spread in family, they are not hereditary. So what are the symptoms with the patient present with? So the most common symptoms being pain, which gradually increases over a period of time and does not relieve with medication. Usually the second most common symptom is swelling, so where the swelling appears and gradually increases in size. And third most common symptoms is fracture following minimal injury. So when you have these symptoms, it's highly advisable to consult your orthopedic oncosurgeon and get it evaluated. So whenever we suspect a patient with bone cancer, we order few investigation to get a proper diagnosis and also the staging of the tumor. The most important test what we do are the X-ray and MRI. Once we have this, then we need a tissue diagnosis. For this we do a simple procedure called as biopsy. In biopsy, we put a small needle and take a small material, tumor cell material for testing under microscope. And we'll come to know the exact type of tumor and the grade of tumor with the biopsy. And this is very much important because there are various types of bone cancers and the treatment of each cancer is completely different. So this needle biopsy is a simple procedure which hardly takes 5 to 10 minutes, doesn't need to cut open the body to do this test, doesn't require any admission or major anesthesia to do this procedure. But the most important thing is cancer doesn't spread by doing a needle biopsy. So biopsy is very important and it has to be done before doing any major surgical procedures, because sometimes a non-cancerous bone tumor can mimic a cancerous tumor on X-ray and MRI, and is vice versa. So the way we operate a non-cancerous tumor to cancerous tumor is completely different, and we have seen so many patients lose their limb, the hand, when the biopsy is not done and the inappropriate procedure has been done. So always biopsy is mandatory to know the diagnosis. So once we know what kind of cancer it is, next we have to know whether the cancer has spread to the other part of the body or not. For that we do a single state test called PET scan, where it screens the whole body from head to toe. So once we have a diagnosis, what is the diagnosis and staging of the tumor, next comes the treatment. So each patient, the diagnosis and the staging report we discuss in a tumor board in the sense where we have all the specialty of doctors like surgeons, radiation oncologists, medical oncologists, radiologists and pathologists. We all sit together, discuss all the report and take an appropriate treatment suitable for that particular patient. So coming to treatment, all these tumors require multimodality approach. They require combination of chemotherapy, surgery and radiation based on the tumor type, based on the tumor grade and based on the stage of the tumor. So coming to the surgical part in this bone cancer, like few decades ago, most of this patient used to end up with amputation, that is losing their hand or limb. But today, with newer imaging modalities and advance in chemotherapy and radiation and trained surgeon performing these surgeries, we can save limb in more than 90% of our patients. And these cancers can be completely cured in 60 to 80% of our patients if it diagnosed early and treated at a proper center. In surgery, we have so much advance now. We have robotic surgeries, navigation, 3D printing and customized jigs. So all this helps to remove the tumor with precision and save the maximum native bone. So the recovery and the functional as well as the oncological outcome is better with these techniques. So the take home message here is bone cancers can be completely cured if they are diagnosed early and treated at a proper bone cancer center. So if you have any of these symptoms which I mentioned, please consult your orthopedic oncosurgeon, get it diagnosed and get the treatment as early as possible. Thank you so much.